like to welcome you to this morning here at Captain Don's Habitat for the start of our 11th conference on healthcare insurance. I would like to acknowledge the presence this morning of the Kingdom representative, Mr. Gilbert Isabella, also the Minister of Health from the island of St. Martin, Minister Emile Lee, Professor Carl Theodore from the University of West Indies, Dr. Stanley Lalta, coordinator of this conference, Arnoud Bouston, the director of the Medical Insurance Office for the Best Island, that's what we call Bonaire, Saint Eustatius, and Ceiba here on Bonaire. I would like to also acknowledge the presence of Professor Van der Ven, one of the main speakers on this conference, Professor Ashley Duits, Mr. Rafael Barrett, Mr. Javier Asin, and Dr. Anton Cumberbatch.
This conference is organized by the Center of Health Economics of the University of the West Indies. And I think we can be grateful that they do not stop to ask our attention for a subject so important to all of us. This year, the conference is also organized in cooperation with the Health Insurance Office BES. Mr. Harms already told you about that. Ladies and gentlemen, this all is a serious subject, serious business. I hope that beside the serious business, you also enjoy your stay here on Bonaire, that you have time to relax and to visit our beautiful island.
In the coming 3 days, you will exchange knowledge, ideas and visions with each other. As Kingdom representative for Bonaire, Saint Eustatius and Ceiba, together with my staff, I provide the link between the Netherlands and the 3 public entities, Ceiba, Statia and Bonaire. Fondation Mariedal has developed into a professional medical organization. The foundation, which also houses a home for the elderly, home care and pharmacy, has a capacity of 35 beds for hospital care. And because of the collaboration with the Dutch academic hospitals, the VU and Amsterdam Medical Center from Amsterdam, there are now 15 functions of specialists available who provide 9 types of specialisms. And I hope it will contribute to new insights and knowledge on the healthcare. Thank you so much. Have a nice day. Passa bom dia. Até depois.
The theme of the conference is particularly well chosen because in the first 10 years, what we concentrated on was really trying to generate funds. How do we do it? Who is doing it? How well? How equitable it is being done? In the second decade, what we really want to focus on is how can we do better? How can we spend wiser? How can we ensure that in constrained environments, budgetary environments, we can all spend that money better? And this is the theme of the conference.
And all of us are going to feel much better about what we have been doing in our own countries, and much better about how we are going to continue doing the things that we are doing in our country. So again, I want to endorse the welcome and to wish us a very pleasant and productive sessions for the next few days. And I hope that, although I know we are going to be very busy, I hope that we're going to find time to enjoy this beautiful place that we are in for the next few days. Thank you very much.
So in the mid-80s, we were discussing that. And more there was consensus that we should have a transition from purchasing by government towards purchasing by insurers, sickness funds, who should compete, where the consumer should have a choice every year among these competing insurers.
We should focus more on value and the patient and less on other topics, which seem, of course, the ones beforehand, but nevertheless, very important to get out of this visual circle we're in, with every time focusing on money and purchasing and then not getting the results we want and then starting all over and over again. We're living in a golden age of medicine. As you all know, the sky is the limit for technique. The sky is the limit for drugs. The sky is the limit. I mean, if we were mice at this moment in time, cancer would have been banished all over, right? We still have to learn from each other, from systems, and what kind of system is the best to use. But again, it's very complicated. So not only at one perspective, but all of them.
100% of the risk, of the financial risks, is for the government. Only about 30% is paid by of the insurance premiums is paid by the employers. The people themselves don't pay premiums, and total budget is of the insurance company is paid by the Ministry of Healthcare, Welfare and Sport.
Most of the providers in the USVI have accepted NHI, which is a very good thing. And I must say we have all of our local private providers within our network, even though we had pushback from them. After the contract with JIPA was signed, then we started with the registration period. And we registered individuals from September of 2015 until February of 2016. When we started, the steering committee recommended that we register the entire population in 2 months. And I was like, that's impossible. So to confirm my feeling, I called Dr. Lalta and I asked him, what do you think would be the just period for us to register the entire population? And he said 6 months. I said, thank you.
When you're ready to go live. And again, that goes back to your timeline, your implementation, so that you can focus on what it is you need. Because what happens if you don't have that, you then have to backfill, and it becomes all the more challenging to get people that are not orientated, that don't understand the policies, to fill in.
Well, there is something that you have to understand, and that is that when nobody keeps track of how much is spent on healthcare, it's never too much. So, and then you realize what the resistance was, because when there would be an NHI, you had full transparency on how much money was going into healthcare, and then it would seem unaffordable, and then some of the influential groups would be cut in their income.
We should share our experiences. We should share, what we went through in order to learn, because we believe also in Suriname, and in view of all that we have presented and the economic challenges, we say in Suriname, healthcare should not be commercialized. Healthcare should not be seen as a commodity. We cannot afford that in Suriname. That is what we stand for. That is what we're trying to do now also.
We started with 128,000 insured people of a population then of 153,000. Actually, there are 151,000 insured people in the fund, which is almost the complete population of Curaçao. So the coverage rate in terms of accessibility went up from 84 to 95%.
Dr. Asin actually said that NHI isn't actually a health insurance, it's actually about health system reform. And I think that's important, but I'll actually help to put that in a little bit of a context of how our thought process and the words we put together, put behind it, actually form part of the foundational pillars for what we want out of universal health coverage as well.
Aruba introduced its healthcare system, universal healthcare coverage, in 2001, and in doing so was the first country to introduce universal healthcare in the Kingdom of the Netherlands.
So I won't hesitate no more, it can't.